All right, welcome back. I hope you had a great holiday weekend and are back to studying for your RBT exam. Today we are starting part 25 of our RBT exam practice question series. So if you're new to the channel, welcome. If you're coming back, welcome back. Please like and subscribe my videos. If you are enjoying these, that helps me, that supports me, and I appreciate it. If you're looking for our study materials, please check out our website or our shop, gumroad.com/RBT exam review. We offer 2 full practice exams, a RBT task list study guide. Our combo pack comes with everything and flashcards. And of course, we have our competency study guide as well. So continue studying hard. Any questions, comments, please leave them below or email me. I'm happy to help. Other than that, let's get to the questions. Question 1. Jim's brother received an iPad for Christmas. He was taught to man for iPad by saying, "I want iPad, please." Jim's brother will now say, "I want iPad, please," in the presence of both the computer and the remote control. What is the most likely explanation for this? Okay, very straightforward question to start. The scenario is your client, or I should say Jim's brother, was taught to say, I want iPad, please. And now he is saying that phrase in the presence of other stimuli. So what does that represent? Is that stimulus generalization, response generalization, pairing, or shaping? What's not shaping? We're not reinforcing any approximations of behavior, right? We're not trying to teach a new behavior. We've already taught it. So shaping is out. Pairing, we're not pairing anything. We're not pairing any neutral stimuli with already established stimuli, okay? So it's some sort of generalization. Is it stimulus generalization or response generalization? Well, what is our trick, right? What is our memory jogger? With stimulus generalization, we have one response, multiple stimuli. With response generalization, we have one stimulus, multiple responses. In this scenario, how many responses do we have? Well, we have one. We have "I want iPad, please," and we have 3 stimuli. Therefore, it must be what? Stimulus generalization. Pretty easy generalization question, all things considered. If you don't understand that question, go check out my video on stimulus generalization, response generalization. Okay, 2 difficult concepts that once you understand, okay, you'll never forget, but they are difficult at first. So if you don't understand why that stimulus generalization, why we have one response across multiple stimuli, go check that video out. Okay, but pretty straightforward question. All right, ethics question. RBTs must maintain the dignity of their clients. Which of the following scenarios represents maintaining client dignity the best? So when we talk about client dignity, we're talking about just basic decency, okay? What you would afford to people without disabilities or without people you're not working with, okay? Basic respect, pretty much, right? All we ask is for the same thing for our clients, okay? So which of the following scenarios shows us maintaining client dignity, okay? A, your 13-year-old client is an excellent reader, but his programs involve reading books for 5 and 6-year-olds. Is this maintaining the dignity of the client? Well, no. If your 13-year-old client is an excellent reader, we should be giving him things that are appropriate for his age and his skill level. 5 and 6-year-old books are not appropriate for his age or skill level, okay? You wouldn't take someone who isn't your client, okay, without the needs of our services, who's an excellent reader, and make them read books for 5-year-olds. Okay, it's just inappropriate. So A is not maintaining client dignity. We want appropriate services, appropriate skill level reinforcers, programs, etc. B, in response to your client throwing their lunch on the ground, you tell them they don't get to eat anything for the rest of the day. Well, this is definitely not maintaining client dignity. Okay, everybody has the right to a basic meal, right? They have to eat. So withholding food from them as punishment for an entire day is unethical, okay, and or irresponsible. So it's one thing when we talk about manipulating motivating operations where we withhold maybe a snack, maybe a treat they like, okay, a dessert. But if you're withholding entire meals for an entire day, it's certainly unethical and certainly not maintaining dignity. C, your BCBA is discussing your client's treatment plan. Since your client is in the room, your BCBA asks the client his opinion on the schedule. Is this maintaining dignity? Yes, absolutely. Okay. Our clients should be involved in their treatment planning to the full extent possible. They're not going to make all the decisions, right? They don't get full decision-making power. But if your client is capable, they need to be involved in treatment planning, okay, as much as possible. Your BCBA involving your client in this meeting is absolutely maintaining client dignity, okay? They have that right. They have, and it's showing respect to them, okay? Because they're the ones who we're working with, okay? And when we're talking about them in front of them, okay, they should be treated like they're there, okay? They shouldn't be ignored. So C is very good. Remember, we're always looking for the best answer. So when you find a good answer, make sure you're still reading all your answer choices just to make sure. D, you are toilet training at your clinic, which is filled with other RBTs and clients. You leave the door wide open during toilet training because it is more convenient for you. This is not maintaining dignity, okay? When you're using the bathroom or when we're using the bathroom, we don't want the door wide open, all right? Especially if your client's older or whatever it may be, okay? We don't, you should be treating this situation, okay, with respect, with privacy. That door needs to be closed, okay? D is not a good answer. Our best answer here is C, okay? The best representation of maintaining client dignity, showing respect to the client, showing basic decency. You're recording how often your client changes YouTube videos while watching videos on their phone. Your BCBA asks you to use partial interval recording for 3 minutes with 30-second intervals. Your client changed videos the following number of times per interval: 3, 0, 0, 0, 7, 4. How many responses would you record in this situation? All right, where will we start in this question? Well, let's start with ask you to use partial interval recording. So we know we're using this type of data collection, partial interval. And what do we know about partial interval recording? Well, we know that if the behavior happens at all during our interval, it counts as a response, okay? So we also have 3 minutes with 30-second intervals. We have 6 total intervals, okay? And then we have our partial interval data. So how many responses are you going to record using partial interval recording in this scenario? So we have 3 on the first interval. Would you record a response? Yes, right? If it happens at all during partial interval, we take a response. Then we have 0, 0, 0. Did the behavior happen at all? Nope, no responses. Then we have 7. Yes. Then we have 4. Yes. So how many responses? 3 total. Very straightforward partial interval question. However, okay, you have to know what it's asking, all right? And you don't want to get lost, okay, in some of the numbers and the technicalities, all right? All we're doing simply is looking at partial interval data, okay, and recording responses. Okay, partial interval, remember, if it happens at all during the interval, okay, you record it. Therefore, we don't need to know how long the behavior occurred. If we're looking at whole interval recording, okay, we would need to know, did these responses occur for the entire interval or not? But we don't need to know that for partial interval, just whether or not they occurred or not. So the responses you record in this situation are 3. John's mom wants Tim to dress himself in the morning. She requests that you teach John to put on a shirt. John loves Skittles, so you reinforce John with Skittles. You first deliver Skittles when John puts the shirt over his head. You then only deliver Skittles when John puts the shirt over his head and one arm through. You then only deliver Skittles when John puts the shirt over his head and both arms through. Finally, only when John puts the shirt completely on. What intervention did you use? So, easy question, in my opinion, okay? If you know your terms, if you know your definitions, if you're fluent. This is a question where reading the question should take longer than actually answering it. And if you're good, you should know the answer to this question halfway through, okay? You should immediately know it. If you don't know it, okay, you need to work on your fluency a little bit. Go back to the task list study guide, the task list video, and brush up on those terms and definitions, okay? Super simple question, right? What intervention are you using? What are you doing, right? Well, you reinforce the first instance of behavior, okay? And then you need the behavior, you need that response or that behavior, okay? To gain a little something closer and closer to the response that you ultimately want to see, which is John putting a shirt on. So what are you doing? You're reinforcing approximations of a behavior to reach, okay, a final target behavior. So what are you doing? Are you probing? No. Are you negative reinforcing? No, this is positive reinforcement. Are you shaping? Yes. Shaping is simply reinforcing approximations of a behavior, which is what you're doing, right? Burst the shirt over his head, then one arm through, both arms through, entire shirt on, okay? Textbook shaping should be a very simple question, okay? If it's not, go brush up on some of your shaping and probing terms. And then FCT, of course, is functional communication training, which is not occurring in this scenario. The trick here, okay, the trick to the exam, or one trick to the exam is doing the questions quickly, the easy ones, okay, and then starting to know the answer to questions halfway through. Okay, as you're reading this, you should already start predicting the answer. If you can start predicting the answer to these questions, okay, then when you take it for real, the test is going to be very, very easy. So start trying to predict the answer to questions before you already answer the question. Billy engages in verbal stereotypy. He will repeat the same line for Paw Patrol throughout the day. Your BCBA asks you to record the IRT of Billy's stereotypy. The first response occurred after 2 minutes, the second after 2 minutes, third after 5 minutes, the fourth after 3 minutes, and the fifth after 6 minutes. What is the average IRT for stereotypy? All right, so an average question. So we're going to do a little math here. Don't panic about the math, right? Remember, you have scratch paper and you have calculators. The most complicated math you'll need to do on the exam is finding an average, okay? Everything else will be just basic addition or subtraction. So how do you find an average? Okay, you take your total amount and you simply divide it, okay, by the number of responses or the number of instances, okay? So in this situation, we took IRT into response time of Billy's stereotypy. So what is IRT? IRT is the time between two responses. So response 1 to 2, 2 to 3, 3 to 4, 4 to 5, 5 to 6. What is our IRT in this situation? Well, our first response, okay, doesn't count in IRT, okay, because it's IRT is from response 1 to 2, 2 to 3, etc. So we start here. From first response to second is 2 minutes. From second to third is 5 minutes, so we have a total of 7. From third to fourth is 3 minutes. We have a total of 10 minutes. From fourth to fifth is 6 minutes. We have a total of 16 minutes of IRT. Now, how many instances do we have? Well, we have first to second is 1. Second to third is 2. Okay. Third to fourth is 3. Fourth to fifth is 4. So we have 4 instances. 16 total minutes. Divide that by 4 instances. And what do you get? You get 4. The average IRT for this situation is 4. Okay. Simple average question, but as an RBT, you need to know how to find averages. All right. And that's what the test is going to ask you. Okay. Find an average duration, find an average frequency, find an average latency. All right. Average doesn't change. It's just the type of data you use might change. Okay. So again, this is the most basic math you're going to use, right? Simple averages. Okay. And that's how you find it. So if you don't understand averages, either go through this question a few times. Okay. Or practice a few basic average questions. Okay. Not hard. Okay. But they might ask you how to find it. So in this situation, the average IRT for stereotypy is simply 4. You worked all summer teaching your client how to introduce himself and how to join in conversation with others. After the first week of school, your client's teacher reported that your client struggles initiating conversation with his peers. What most likely explains this scenario? All right, so this is another one where I think you could predict the answer to the question before you even read the answer choices. Okay, so what happened here? You taught a skill to your client. Okay, so you intervened all summer teaching them how to introduce themselves and how to join in conversations. Okay, so you taught the skill, and then your client goes to school, a different environment with different people around, and they can't do that skill. What is the issue? What is the problem? Is it lack of maintenance? Is it lack of generalization? Did your client never actually learn the skill? Or is your client teacher just doesn't understand how to implement the intervention? Okay, so D can be eliminated. Maybe they don't understand your intervention, but that doesn't really matter because you've already taught the skill, right? So that's not the issue here. The intervention wasn't the issue. So same thing with C. Your client never learned the skill. Well, you taught them all summer, right? And so if it's a problem that they can't do it at school, okay, Well, that's the issue here. It's not they didn't learn the skill, it's that they can't do it at school after doing it with you. So is that a lack of maintenance or a lack of generalization? Well, that's going to be a lack of generalization. What is generalization? It's the ability to perform a trained or learned skill in an untrained, unlearned environment with unlearned, untrained stimuli. So in this scenario, you spent all summer either in the home or the clinic, wherever, teaching conversation initiation to your client. They go to an untrained, unlearned environment. Can't do it as a textbook lack of generalization. Okay, that most likely explains this scenario. This is a good question, okay, because we're looking for the best answer here. And now you might be able to make an argument that your client never learned this skill, okay, but we always want to go with the most simple explanation, okay? And given what we know about this scenario, lack of generalization makes a lot more sense, okay? If you spend all summer working and teaching this, okay, and then you expect them to do it and they can't, most likely lack of generalization, okay? Back to the drawing board. How do we generalize peer initiation, okay, outside of the home with new peers, new people? Traditionally, negative reinforcement is considered a way of reducing behavior through verbal reprimands or criticisms. However, in applied behavior analysis, negative reinforcement is what? All right, so these type of questions on the exam are very straightforward, but they're using how they're phrasing the question, okay, in an attempt to throw you off, okay? But don't get thrown off, okay? All the question is asking is what is negative reinforcement? Don't worry about that first part, okay? We just want to know what negative reinforcement is, okay? Is it the same? Is it reducing behavior through verbal reprimands or criticisms? Well, no, right? Because we know reinforcement increases behavior, okay? A is what? Positive punishment. That's not what negative reinforcement is. B, the addition of a stimulus that reduces future behavior. So what's the problem here? Well, the addition is positive, okay, and then reduces as punishment. So B is also positive punishment. We need negative reinforcement. C, the removal of a stimulus that increases future behavior. So removal negative, increased reinforcement. C is great. C is negative reinforcement, okay, removing a stimulus, increasing future behavior. What about D, the addition? Oh, no, right, that's positive, okay? So the best answer here is C. Negative reinforcement is the removal of a stimulus that increases future behavior. And they want to test you on this because negative reinforcement commonly is referred to as something else outside of ABA. But now that you're in ABA and in RBT, negative reinforcement means removing something to increase future behavior. Okay, so pretty easy question. You want to graph behavioral data that you recorded last month. The data represents your client's attempts at elopement. What graph is the most used graph in ABA? What graph are you most likely going to use? Okay, is it going to be a line graph, a scatter plot, a bar graph, or a histogram? So you might use a scatter plot or a bar graph or a histogram at some point, okay? But if you're simply graphing elopement data, okay, the most commonly used graph in ABA, okay, is a line graph, right? Line graph, graphing questions, boil down to this, pretty easy, okay? Know that a line graph is the most commonly used graph. Know the parts of a line graph with the x-axis, the y-axis, okay, condition change lines, data paths, graphing questions, no problem, okay? Shouldn't scare you. You should get those right. Easy, easy. The most commonly most used graph in ABA is a line graph. Yesterday, your client came into the clinic with Kool-Aid. During snack time, he spilled his entire cup on his shirt. You took him to the bathroom to change shirts, and he started to engage in maladaptive behaviors. From the time you entered the bathroom to the time you left the bathroom with a clean shirt, it took you 30 minutes. What kind of data is this? Okay, so what kind of data are we looking at? We want to know you went to the bathroom to change shirts with your client, okay? It took quite a while because he had to change shirts. He was engaging in behaviors, okay? And after 30 minutes, you finally left the bathroom. So we're looking for the total time spent in the bathroom. When we're looking at total time, okay, of a response or a scenario, what are we looking at? Are we looking at rate? Well, no, what is rate? Rate is just frequency, okay, over time. We're not counting anything, okay? We're looking at total time. Whole interval. Whole interval, yes, we do look at total time, right? But we're looking at it on a per interval basis. We don't have intervals here, okay? We have an isolated scenario, okay? So don't get confused. It's not whole interval. Duration. Yeah, duration looks good, right? We're looking at the total duration of time spent in the bathroom, which is 30 minutes, okay? So duration probably most accurately represents this data. Always read your answer choices. Latency. Are we looking at the time in between an SD to the first response? No, we're looking at one isolated scenario and the total duration of time spent in the bathroom, which is 30 minutes. So our kind of data is duration. Dual relationships and conflicts of interest should be avoided when taking on new clients. Which of the following scenarios best represents a situation where you could not assume the role of RBT on the client's case? All right, so this is a not question. When we look at not or accept questions, 3 of these, okay, are scenarios that you could assume the role. 1 is not, okay? So you have to read the question carefully and look out for the not and the accepts. So which of the following scenarios best represents a situation that might represent a dual relationship or a conflict of interest? Okay. A, the client is the son of the manager of the gym where you work out. Could you take this case? Yeah, sure. Unless you personally are best friends with the manager, okay, you can take this case. Just because it would be like, well, I eat at a restaurant and the manager of that restaurant brings his son in, okay? If you don't have a personal relationship with that manager, that's perfectly okay, okay? So A, you could most likely assume the role, okay? Let's see, B, the client is your best friend's nephew. Would this represent a conflict of interest? It might, right? Because it's your best friend. You might have met the nephew before, okay? So now you have a different relationship with this client outside of just professional, because now your best friend might be asking you about the situation and the nephew isn't actually the best friend's child, okay? So it comes into issues with privacy as well if your best friend is asking you questions about the case, okay? So there's a good chance conflicts of interest, okay, could come up here or dual relationships could occur. So B, it's probably not a scenario you could assume the role of the RBT on the client's case. Okay, it's your best friend. B so far is our best answer. Let's keep reading. The client is the brother of a client you currently work with. Well, that's fine. Okay, you already work with the brother, right? You already work with the family. It's simply just their sibling, which happens all the time. Okay, C is perfectly acceptable. Okay, for you to assume the role. And then D, the client goes to the same school as your daughter. No, again, as long as you're not personally involved with that client, okay? Client could be a different age, it could be a different class, right? You might not even know the client until they come into your clinic, right? Totally fine. The best answer here is the client is your best friend's nephew, okay? Best friend already represents a dual relationship, potentially a conflict of interest. Best represents a situation where you could not assume the role of the RBT. Remember, ethics questions aren't tricky. It's common sense, okay? You want the answer that's not too strong and not too weak. And then the situation B, it's your best friend's nephew. Ethics questions aren't difficult, okay? I just think they might be a little tricky, right? This one's a little tricky. It's not difficult though. All right, so that wraps them up. I hope you enjoyed those. If you did, please like and subscribe. Again, if you're looking for study materials, check out our website, check out our shop. Keep working hard. Any questions or comments, leave below. I'm happy to help. Other than that, study hard, and I will see you soon.